Okay, so physiology of pregnancy. There are physiological, biochemical, anatomical changes that occur during pregnancy. There are certain physiological changes occurs during pregnancy, and the most of the systemic changes return to the pregnancy in sixth week after delivery. These changes during the pregnancy maintain a healthy environment for the fetus without compromising mother's health. And the physiological changes are gastrointestinal changes, in which patient or the mother has nutritional requirement including vitamin, mineral, are increased, so mother's appetite also increases during pregnancy. Pregnant women tend to rest more often, conserving energy than by enhancing fetal nutrition. So this is gastrointestinal oral cavity. Patient feels salivation, gums becomes hypertrophic and hyperemic, in easily bleeding. Secondary to increase systemic estrogen. In pregnancy, estrogen level is increased. That's why patient are more prone to develop a hyperemia or bleeding. In gastrointestinal motility, there is reduced gastrointestinal motility due to progesterone or decrease the hormone motilin stimulates smooth muscle in GIT. Hence, gastric emptying is delayed or slowed in pregnancy. And similarly, in other parts of the GIT, constipation is there in pregnancy, so increase due to water reabsorption. In stomach, there is increased gastrin production, results in increased acidic volume and decreased pH. In mucus production, increase, and peptic ulcer disease usually improves during pregnancy. And another is enlarging uterus, slowers emptying time, and increased intragastric pressure results into increased acidity and increased gastroesophageal reflux disease. So this occurs in pregnancy. And in gallbladder changes, there are progesterone decreased motility of the gallbladder, which results decrease emptying time of the bile, and stasis of the bile results into stone formation and gallstones occurs. That's why in a mnemonic of cholelithiasis we read F's, four F's: female, fertile, 40, and female, fertile, 40. Yes, three F. Sorry, female, a for female, fertile means during fertility or during pregnancy there is increased chances of gallstone cholelithiasis because of progesterone, decreased motility of bile formation, motility of gallbladder, and there is decreased emptying of the bile, results into stasis and stone formation occurs in pregnancy. So that's why the mnemonic 3F: female, fertile, and 40. So this is the 3F of cholelithiasis, stones in gallbladder. And the liver changes are no morphological changes but functional changes in liver may be occurred due to decreased plasma protein or albumin and globulin synthesis in the liver, and increased serum alkaline phosphatase. There may be functional changes occurs in liver during pregnancy. And urinary system results into each kidney increase its length and width, and renal, pelvis and ureters dilate and lengthen. There is an increased urinary stasis due to increased infection, and stone formation can occur in the pregnancy. So renal function may be changed due to change in increased maternal and placental hormone. There may be changing ACTH, ADH, cortisol formation, increase in plasma membrane volume. GFR increases by 50% in pregnancy. Renal blood flow increase by 20 to 25%. That's why resultantly increase in GFR occurs in mid trimester and second trimester. Urine volume does not increase, although GFR increases because of reabsorption of the water. So that is renal changes. And another changes are creatinine and blood urea nitrogen decrease because of increased renal clearance, and there is rate GFR is increase. Glycosuria is not necessary as normal. Protein urea changes occurs little bit during pregnancy. Bladder changes are displayed upward and anteriorly in large uterus as results increased pressure leading to urinary urgency and frequency increases during pregnancy. Hematological system changes includes increased blood volume, and increase until the average increase in the volume occurs. And the mechanism: increase the volume of the blood, and increase in volume of RBCs, because baby also developing fetus needs blood. That's why increase in blood occurs. Aldosterone related factor due to pregnancy contribute to this effect and increase water and salt retention. RBCs increase. Iron is needed in pregnancy. That's why mothers are prescribed folate supplements. WBC count usually increases, and platelets are also increased in pregnancy. And clotting factor: several factors like factor 1 and factor 8 is increased to less extent. Factor 7, 9, 10, and factor 12 to lesser extent increase, and there is decrease in factor 11 and factor 13 in pregnancy. Cardiovascular system: what cardiovascular systemic changes occurs in pregnancy? There is heart rate slightly shift in position. Heart slightly shifts from its position. There is enlarging uterus results into diaphragm displays upward, shifting of apex beat, and cardiac capacity increase to 70 to 80 milliliter. There is cardiac output increased by 49% during pregnancy. During early pregnancy, stroke volume increases by 25 to 30%, and with the lengthening sensitization, heart rate increases in the pregnancy. Blood pressure: what happens to the blood pressure? Systemic blood pressure declines slightly during pregnancy. A little change in systemic blood pressure, but diastolic blood pressure decrease by 5 to 10 in pregnancy, because of there is a decrease in vessel changes. Venous pressure: there is no change in upper body. No change in venous system. Increase in lower extremity enlargement, decrease venous return to the heart, and increase pressure as a result of edema. Pulmonary system: patient becomes capillary becomes dilated, and respiratory route, nasopharynx, larynx, trachea, bronchi make breathing difficult, and through nose. Enlarged uterus pushes diaphragm and lungs as well. So this is the pulmonary changes. In summary of the pulmonary changes: change in volume, tidal volume increases, residual volume decreases because of diaphragm is pushed upward, and expiratory reserve volume is decreased by 20% in the pregnant woman. Functional respiratory changes: these are not so much significance. And changes in breast: during pregnancy, breast increase in the size, enlargement of the nipples, increase vascularity, and pigmentation in areola in the pregnancy. Changes in skin: hyperpigmentation occurs in the some body parts. Face is forehead and cheeks refers to the colostoma, and abdomen becomes subumbilically midline, dark purplish pigmentation in the linea alba and linea nigra. And extra gravidum occurs: enlargement of the abdomen, stretch of collagen fibers on the skin results in the effect of ACTH. In vaginal changes: vagina increase capacity, length secondary to hypertrophy in the lining of the epithelium, muscular layer, increase glycogen content in the wall of secondary to the effect. Uterus upper part fundus and body changes, and in the upper uterine segment, these are the uterine changes. Lower part cervix and isthmus changes, and the lower uterine segment. Weight increases in the pregnancy. Minor disorders in the pregnancy like nausea or vomiting can happen in the pregnancy. And how can we manage that? Resume the mother small frequent meals. Dry meals should be given. Reduce fatty and fried diet, and the patient should be asked to rest. So we discussed in above slides about physiological changes of the pregnancy. These changes occur during pregnancy,